अस्सलाम वालेकुम डियर स्टूडेंट्स। आज हम इलेक्ट्रोकार्डियोग्राफी यानी ईसीजी के बारे में बात करेंगे कि ईसीजी है क्या चीज़ और इसकी कंपोनेंट्स क्या हैं, इसकी लीड्स क्या हैं और हम ईसीजी की पर्पस किस पर्पस के लिए यूज़ करते हैं। हम ईसीजी से किस तरह जो है हार्ट रेट कैलकुलेट कर सकते हैं। दो तरीके हम इंशाल्लाह यहाँ पे डिस्कस करेंगे कि दोनों तरीकों से हम ईसीजी पेपर से जो प्रिंटेड आ जाती हैं उससे हम पेशेंट के हार्ट रेट का किस तरह अंदाज़ा लगा सकते हैं, किस तरह हम कैलकुलेट करते हैं द पेशेंट हार्ट रेट फ्रॉम द ईसीजी। इसी तरह हम अ, एक दो एब्नॉर्मलिटीज का भी जिक्र करेंगे कि जो ईसीजी से हम आइडेंटिफाई कर सकते हैं उसका भी हम जिक्र करेंगे। तो चलते हैं ईसीजी के बारे में। The heart is a vital link in the oxygen transport system, pumping blood to the pulmonary and peripheral circulation system to supply oxygen and other nutrients required for the metabolism in all tissues. Heart जो है at the same time from the left ventricle it pump blood to the lungs and as well as to the whole body. Lungs को क्यों पंप करता है? Just to receive the oxygen, just for the oxygenation, and through the aorta to the whole body, the oxygenated blood जो है टिश्यू सेल के लिए ताकि वो आगे जाके मेटाबॉलिज्म और ऑक्सीडेशन में यूज हो सके। So the beating heart generates rhythmic electrical impulses that cause mechanical contraction or the pumping action of the cardiac muscle. और ये जनरेशन जो है ये हार्ट बहुत करता है। आगे हम डिस्कस करेंगे कि इसकी जनरेशन कहाँ से होती है और ये एक रिदमिक एक्टिविटी है। मीन इट रिपीट इटसेल्फ आफ्टर द सेम टाइम with the similar and sequence of the events that repeat itself again and again, that is known as the rhythmic. And it's electrical impulse. It's all about the change in the electrical charge on the surface of that heart muscle. So this is the repolarization, depolarization, then depolarization, repolarization. So this is all story about the electrical charge changes. So this is electrical impulse, and that ये impulse जो है फिर आगे जाके ये ventricular muscle को कंट्रैक्ट करते हैं जो हार्ट पंपिंग का जरिया बनते हैं. So that is that heart beating heart generate rhythmic electrical impulse that causes mechanical contraction or the pumping action of the cardiac muscle. Some of the electrical current produced by these rhythmic impulses is detectable by electrodes that may be placed on the surface of the skin, and the recording of these current, these produced by the rhythmic impulses, when they are detected, they are recorded in the form of a waveform, which is known as the electrocardiogram, shortly known as the ECG. So if we talk about the ECG, so it is made of three words: the electrocardiogram. And the electrocardiogram, the gram mean recording, and the electro mean that it is an electrical activity, and from the cardio obviously it mean generated by the heart muscles over time. So ECG is the recording of the electrical activity generated by the cells of the heart over time, that is known as the electrocardiogram. Electrocardiogram can be used and is maybe very useful in the diagnosis of the cardiac arrhythmias, and that is one of the gold standard used in the diagnosis of these arrhythmias that may be below the normal or above the normal. They may be the bradycardia or tachycardia, myocardial ischemic and myocardial infarction, pericarditis, electrolyte disturbances, drug effects and toxicity, non-cardiac disease like the pulmonary embolism. तो इन सब में जो है ECG जो है ही यूज की जा सकती है. So this is the normal ECG. We will discuss in detail about this diagram in the upcoming slide. So this is the electrocardiogram, the ECG or the EKG, and यहाँ पे हम देख सकते हैं कि there are some waves and they are just named as simple in the sequence of that alphabetical simple. Otherwise, there is no such um, message behind that. That why The P stand for what, the R stand for. This is just the sequence of alphabet. Nothing specific reason for why they are known as the P, Q, or ST. So there is one wave known as the P. Then there is a straight line, mean there is no such activity. Then there is Q, and then R, and then the S. Again, there is no activity, and then this is the T wave. So there are actually three waves: the P wave, QRS complex wave, and the T wave. Similarly, there are two segments: the PQ segment, and this one is known as the ST segment. And this is, so there are intervals as well. So we will discuss them in the detail in the upcoming slide. So ECG is a recording of electrical activity of the heart conducting through the ions in body to the surface. The basic electrophysiology: at rest, when the heart muscle is not contracting, the electrical charge is positive on the outside of each cell membrane, but negative inside. Just like the other cells, the resting membrane potential is minus, and there is more positivity outside the cell. And when there is action potential reach to the cell, तो वहां पे क्या होता है, चैनल ओपन हो जाते हैं and the positive charge they enter across the membrane inside the cell, they enter inside the cell and lead to the positivity of the charge. So वहां पे जो negative charge inside होता है वो positive पर जाते हैं gradually. This is actually known as the depolarization. So depolarization occurs when ions move across the membrane and rendering the inner surface more positive, thus causing the contraction. So it means ये जो depolarization repolarization इसी की वजह से ये contraction relaxation होती है. So when there is depolarization of the heart muscle, it lead to the contraction of the heart muscle, and the repolarization again it lead to the relaxation of the heart muscle. So that systole or that contraction relaxation of the muscle is simply the depolarization and repolarization of the that heart muscle. The changing electrical status across the cell membrane causes voltage changes within the heart muscle, and these voltage differences can be detected at skin level and measured with different electrodes placed on the skin, and which we will discuss in the upcoming slide. What are the different types of electrode? Normal conduction pathway. This image illustrates the electrical conduction system of the heart, which control the timing of the heartbeat by coordinating the contraction of the atria and the ventricles. It shows four key events, or we can say the four key stages of cardiac excitation along with the corresponding ECG or the electrocardiogram components. If we look at the first event, the SA node generates the impulse and there is atrial excitation begins. The location of the SA node, that is in the right atrium, and the action of here is the SA node act as the heart natural pacemaker. It initiates an electrical impulse that spread through the aorta. And as a result, there is contraction of the atria, which we call as the atrial systole. And the ECG, we can see here, this is the P wave, and that P wave, the appearance of the P wave that represent the atrial depolarization. And the second event, when the impulse delayed at the AV node, the location here it is between the atrium and the ventricles. This is the AV node, which is present between the atrium and the ventricles. The action in this event, this is the impulse is briefly delayed to allow the atria to fully contract the empty blood into the ventricles before the ventricles contract. And hence, here there is some clear segment and which represent the delay between the atrial and the ventricular depolarization. The third event where the impulse passes to the heart affects the ventricular excitation begins, and the pathway for this event is the impulse travel down the bundle of His. These are the bundle of His. Then through the right, these are the two branches. Then through the right and left bundle branches towards the apex of the heart. While the action here it is the excitation begins in the ventricles. On the ECG, the QRS complex begins. This is the Q, and there is which this downward movement of the Q that simply mean the ventricular depolarization has been started, or we can say the QRS complex begins. And the last stage, which is the ventricular excitation complete, the pathway is, or this event is, the impulse spread through the Purkinje fibers, causing the coordinated contraction of the ventricles, both ventricles. And here the action is the ventricles contract, which we call as the ventricular systole, pumping blood to the lungs and body through the pulmonary artery and through the aorta. On the ECG, we can see here there is end to the QRS complex, which simply means that is the completion of the ventricular depolarization. So the pathway is from the SA node to the atrial muscle and then to the AV node, then to the bundle of His, into the left and right bundle branches, and then the Purkinje fibers, and then in the end, the ventricular muscle. So this is actually the normal conduction pathway of the impulse in the heart. This coordinated conduction system ensures efficient blood flow and proper timing of the heart contraction. Abnormality in this system can lead to the arrhythmias or other heart conditions. This is actually the graphical representation of what we discussed in the previous slide. You can see here, this is the QRS completion. This is the completion of QRS, and then there is the T wave. There is the generation of the impulse at the SA node, then the AV node. There is a delay now. Then start of Q, then the end of QRS. There's the contraction of the ventricles. Now, the recording of the ECG, the detail about the leads of the ECG. So there are 12 lead ECG, and these 12 lead ECG include the 6 limb leads and the 6 chest are the recorded leads. Among the 6 limb leads, 3 of them they are the standard leads, and 3 are known as the unipole leads. Each lead incorporates 2 electrodes measuring the potential or voltage difference between them. The positive electrode detects the electrical impulse, while the neutral electrodes completes the circuit. The ECG monitor placed in the circuit detects the electrical activity. The purpose of these 12 lead ECG is that to evaluate the heart rhythm, the rate, and the conduction. They also detect the myocardial infarction, which simply we call as the heart attack or the ischemia. Similarly, these 12 leads they also assess the hypertrophy, the electrolyte imbalances, and the drug effects. So the standard limb leads, they are 3 in number: lead 1, the lead 2, and the lead 3. The location of the lead 1 is that the exploding electrode is attached to the left arm and neutral to the right arm. In the lead 2, the exploding electrode is to the left leg and the neutral electrode to the right arm. And the lead 3, the exploding electrode to the left leg and then the neutral electrode is to the left arm. The lead 1 that assists the interior surface of the heart, the lead 2 that assists the inferior surface of the heart, and the lead tree that assists the inferior surface of the heart as well. These are the lead 1, 2, and 3. This is actually the location of all these three leads. Now the other three unipolar limb leads, the location of these unipolar limb leads is there are three number: the lead AVR, the lead AVL, and the lead AVF, in which the R mean the right, the L mean the left, and the F mean the foot. So the location of the lead AVR, it is attached to the right arm. The lead AVL is attached to the left arm, and the lead AVF is attached to the left leg or the foot. Here A represent the augmented and the RLF represent the right, left, and foot respectively. The assessment of these leads, the AVR, they assist the right side of the heart, the AVL, that assists the left side of the heart, and the lower one, the AVF, that assists the inferior aspects of the heart. These were the 6 limb leads. Now the 6 chest leads, they can be denoted by the V1, V2, V3, V4, V5, and the V6. The location of the V1 is the fourth intercostal space on the right side. The V2 is the fourth intercostal space, but on the left side. The V3 is present between the V2 and V4, while the V4 is present on the fifth intercostal space at the mid-clavicular line, while the V5 that is present at the fifth intercostal space but in the anterior axillary line, and the V6 is also present at the fifth intercostal space but at the mid-axillary line. The assessment of these leads, the V1 and V2 assist the right ventricle, the V3 and V4 the interventricular septum, and the V5 and V6 that assist the interior and lateral aspect of the heart. These are the location of these chest leads. This is the V1, which is present at the fourth intercostal space. This is the fourth rib. This is the fifth rib space between these two. This is the first intercostal. This is the second intercostal. This is the third intercostal space, and this one is the fourth intercostal space. So the V1 that is present at the fourth intercostal space to the right of the sternum, and the V2 is present at the left of the sternum at the fourth intercostal space. The V3 is present directly between the leads V2 and V4, while the between the V4 and V2 and V4, and the V4 that is present at the fifth intercostal space. This is the fifth intercostal space. You can see here, this is the fourth one, this is the fifth intercostal space at the mid clavicular line. This is the clavicle, and if we draw a line at the mid of the clavicle, so this line is known as the mid clavicular. Then at the same at the fifth intercostal space, the V5 is present, this black circle that is present at the left anterior axillary line. This is the mid-axillary line, the line which is just drawn at the position at the site of the axilla, and the line drawn from the interior to the axilla and lateral to the mid-clavicular line. This line where the black spot, this black circle is present, that is the V5 level with the V4 at the left anterior axillary line. Then the V6 that is present with the V5 at the mid axillary line, which means directly under the midpoint of the armpit or the axilla. These were the location of the 6 chest leads. The ECG that is formed by the three distinct waves, and these are produced during the cardiac cycle. And this is the P wave, which is caused by the arterial depolarization. This is the deep contraction of the atrium, and that's why there is the conduction of the completion of the P wave. The QRS complex, this is the QRS complex. This is caused by the ventricular contraction. And when the ventricular contraction is completed, there is end of the QRS complex. T wave result from the ventricular repolarization. This green color means the repolarization. When there is repolarization of the ventricle, there is the appearance of the T wave on the wave. So the components of ECG, this is the P wave, which represents the atrial depolarization, and its duration is between 0.02 to 0.12 seconds. The QRS complex that represent the depolarization of the ventricles, and their duration is present between the 0.08 to the 0.1 second. The T wave that represent the ventricular repolarization, and the U wave, which is sometimes not important, but if it is present, it should be identified. It represents the late repolarization after the T wave, are little importance but need to be recognized so as not to confuse it with other component. There are two segments and two intervals. The first interval is the PR interval that starts at the beginning of the P wave and ends at the onset of the QRS. They represent the time steps of the impulse traveling from the SA node through the AV node on its way to the ventricles. There is no muscle contraction during this event, and the duration of this PR interval is from 0.12 to 0.2 seconds. The ST segment that starts from the end of the QRS when there is completion of the ventricular contraction and terminates at the onset of the T wave. Following the completion of the ventricular depolarization, there is a period of electrical inactivity represented by the ST segment. So these are the two segments and the two interval. You can see here interval here. One is the PR interval, that is the start from the P and up to that end of the Q, and then the ST interval start from the end of the S till the end of the T. There's two segments. They are present the PQ segment. That means no activity is being here. That is from the end of the P wave till the start of the Q. And the ST is from the end of the S to the start of the T. This straight line, this is actually known as the ST segment. This is the QRS complex. So there are two segments and two interval. The two segments, they are known as the PQ segment and the ST segment. And the two interval, they are known as the PR interval and the ST interval. So this is the normal ECG. Now, the next question is how to read an ECG paper. So ECG paper is made of boxes, small boxes, and the large boxes. There's a red line. These are the grid lines, and the white paper and the lines are the red grid lines, and these are small boxes. So one small box that represent the 0.04 second or 1 millimeter. One large box which is made of 5.2 seconds or 5 mm. 5 large box is present 1 second or 25 mm. The 30 large box, they are equal to 60 seconds. 300 large box is equal to 1 minute. So we will discuss in the diagram here. exactly, start to the whole legi.